Hello, I'm Dr. Edward, the Healing Vet, and I'm here today live streaming for Ask Dr. Edward Anything. So you can ask me pretty much anything you like when it comes to holistic pet healthcare. If you're here with me live, you can ask questions in the comments, in the chat. And I've got a list of questions that people have pre-submitted here as well that I'm going to go through and answer for you all. So just let me get a bit set up here. So the first question for Ask Dr. Edward Anything today comes from Lana. And her question is as follows. My rescue mini fox terrier often seems to gag. A honking sounds like a goose. I was told by a vet that his larynx has been damaged by previous owners having him chained with a metal collar on the balcony for 6 years of his life. When I got him, he had no hair on his neck. The vet said the only thing which will fix the problem would be surgery. So far, whenever he's honking, I open up his mouth and press on his tongue, which seems to help. I'm concerned that when I'm not home, he might choke and have lack of oxygen. What would you suggest, please? So it might be damage to the larynx, but I would suspect it's kind of more likely that it would be a collapsing trachea, which is the windpipe that is in the throat area, that the channel that the air moves in and out of as the animal breathes in and out for the lungs. So I would think that that's most likely it is. There might be damage to the larynx too from the long-term having being chained up and having a collar on. If it is a collapsed trachea, it's very unlikely that your dog would suffocate or die from lack of oxygen if left home alone. I mean, it might be. It's really unlikely. There's not a whole lot we can do with collapsing trachea. Keep stress levels down. You say you press on the tongue, which seems to work. Another thing you can do is gently hold the little nostrils closed until your dog swallows. Sometimes that can help. The other thing that can cause this kind of honking, sneezy sort of thing that animals do can be reverse sneezing when the animal's soft palate gets out of place. It should be kind of hooked on at the back of the throat, so there's an air channel from the nose down to the trachea. And sometimes if that gets out of place, then you get this reverse sneezing, which can also sound a bit honky. So I'm just mentioning that as well. Hello to those of you here listening live. If you would like to ask a question about anything at all when it comes to holistic pet health and integrated veterinary things, you can ask in the chat. I'm going to be working through a series of questions that people have submitted online for us, but love to hear from you in the chat. You know, maybe just say hi, let us know where you're from, what you're up to, what pets you have. It's from Tuvalina, who said that she ordered a product for me that hasn't arrived. So if you're watching and listening, I don't actually provide any products. So I think you might have got me confused with someone else that you've ordered something from. We only provide veterinary services, no products. A question from Jeannie. My dogs get fed high quality food in ample amounts along with probiotics and supplements, yet one of my dogs has the nasty habit of coprophagia. Do I need to have her medically evaluated? Hello, Mitzi's going to come and help. So Mitzi's coming to answer your questions as well, my lovely little fella. There you go, buddy. Coprophagia means eating poo, and there is a surprising number of dogs that eat their poo or the poo of other dogs. Now, though it's really disgusting to humans, it's actually not an abnormal dog behavior. Our domestic dogs, as they've evolved with and lived with humans long term, the first kind of dogs weren't really domestic pets, but they lived in kind of sympathy with or around villages with humans. And one of the things that those dogs used to do was clean up all the human feces. Feces are actually very high in protein and have quite high nutritional value for dogs who eat them. It's not desirable, and it can be difficult to stop them doing it. the best thing is to just be very much on the alert, go out with them and clean up as quickly as you can. Got a question from Kathy online, and hello to all the others of you who I see quite a few eyeballs on the little thing here on the screen. If you've got any questions, please pop them in the chat and I will be very happy to answer them for you. So Kathy's question is, what are the best herbs to grow for top health for dogs? Mine love grazing on basil and oregano in the garden. I think if you have a range of different leafy herbs, then your dogs will self-select whatever they need most on the day. Growing a bit of oatgrass or wheatgrass, having the little seedlings in a little pot can be a nice thing too, particularly if you live more in a city environment, or if you live in a flat or a unit. You can bring a bit of this fresh, vital, green, leafy substances into the animal's diet with that as well. So as long as they're any of the kind of culinary herbs should be totally fine for your dogs. And from a question from Jeannie. No, that's Jeannie's question we just covered. So Angie has a question. Hi, Dr. Edward. What toys, games do you recommend for dog exercise and enrichment? Is fetch too dangerous? I don't recommend a lot of high impact, high arousal play for animals, and particularly ball play. If you throw a ball, the animals get really excited. That jacks up their pain tolerance, and then they will have impact injury happening to their bodies that they won't feel because their pain tolerance is increased. I've worked with a lot of dogs that had kind of like a ball addiction and did a lot of ball play over a long time, and nearly universally these dogs have very high levels of silent pain, soft tissue pain that's been caused by this ball play. The other problem with ball play is that when the ball bounces and lands, it moves really unpredictably. So your dogs are stopping, turning, jumping, diving in very abrupt, high impact sort of way. So you have quite a high risk of blowing out, major injuries like blowing out cruciate ligaments and things like that too. If you want to do safe enrichment and play that's not going to cause harm to your animal's body, then what you need to do is to make sure that, number one, you don't get your dog too crazy and overexcited. If you want a safe way of throwing a ball, for instance, throw the ball, keep the dog with you. When the ball is nearly stopped or stopped, let the dog run off and get it. You can also throw a ball into water. That takes a lot more impact off the joints in the body. And another thing that you can do is play. I would never throw a stick, by the way, because if you throw a stick and the stick lands point first in the ground and your dog arrives while it's kind of poking up, they can get speared right down into their chest cavity with a stick, and it's a horrendous injury. Never, ever, ever throw sticks for your dogs. It can be hideously dangerous and cause a whole lot of harm. I've been thinking about this a bit lately, and I saw a video recently where someone was playing with their dog with a flirt pole, which is a stick with a string and then a little drag toy on the end of the string. But they were playing really kind of slow, calm flirt pole. Little slow movements, the dog's following it and kind of almost stalking it rather than getting super excited, crazy, and jumping all over the place. So that is another thing to do. Other kinds of enrichment that can be really good for dogs, any kind of scent-based games, scattering little treats around for them to find, snuffle mats, lick mats. And in terms of exercise, plenty of walking is a really good way to exercise your dogs. And of course, going out and maybe going for runs, a bit higher impact exercise too. You just need to adjust it for the age and condition that the dog's in. From Helen, wants to never have the dog pulling on the lead. Now, this is a fairly complex issue, because if you want to get your dog so they don't pull on the lead, so they walk on a loose lead, you've got to do quite a lot of foundational connection, communication, and training work. Number one, you've got to get the dog focused with you as the leader so that they're watching where you go and they're actually being led by you rather than them taking off and dragging you around. And then you've got to teach the dog about pressure and yielding to pressure so that you can pick up a little bit of pressure on the lead and the dog goes, oh, we're going here. it takes a little bit of time, and I'm going to be doing an intensive online workshop about this sometime soon too. So keep an eye out on our social pages, and if you can come along if you get my newsletter, which we do every week. We will tell you about when that's on. Kathy's got another question here online. If there's anyone else here who's live with us who'd like to ask a question, please ask it in the chat right away. So Kathy's other question, are there mushrooms that dogs are prone to eating that I should be aware of? I've never heard of a dog eating a toxic mushroom at liberty, just a mushroom growing out in nature that might be poisonous. I've never heard of that. Any of the mushrooms that humans eat that are culinary mushrooms or the more medicinal mushrooms like shiitake and so on and so forth are safe for dogs, and I use them as a supplement with dogs with a range of health conditions really quite often. Louise, her question that she submitted earlier is, our little toy poodle is very aggressive on the lead and starts barking when she sees even a human being a long way away, and then is aggressively barking when a dog gets near. She wouldn't bite, but people move their dogs away. She's not like this when off the lead, so would like to know what we have done wrong. The first thing, I don't know that thinking about what you've done wrong is the healthiest way to think about all of this. I think, in fact, I'm sure you wouldn't be here asking questions if you didn't love your dog and if you hadn't done everything that you thought was the right thing to do for your dog. This is an anxiety problem, reactivity. It's not uncommon. And this kind of reactivity to other people and other dogs is nearly always worse when the animal is on lead. And that's because your dog, when they're on lead, doesn't have freedom to move away, and they feel kind of contained and trapped, and that increases their anxiety levels. So I think thinking about what you might have done wrong is probably not the right way to think about this. I think the best way to think about this is, okay, what can we do right from here on in to help improve the situation? One of the things you could do is come along, drop into wholeenergybodybalance.com and look at our web Bodywork for Pets online home or professional practitioner trainings. There's elements of therapeutic touch that we teach in that program that cause a really powerful relaxation response in your animals. And if you do that every day, we've had many, many students who've seen really significant decreases in reactivity in their anxious pets through using therapeutic touch in the way that we teach in the Whole Energy Body Balance method. Otherwise, you can work with trainers. You can minimize exposure to the triggers. So if you see someone coming, you go somewhere else so that you don't escalate that dog into the red zone of crazy reactivity. And there might be some pain issues too. Often anxious dogs have silent pain, soft tissue pain, that is exacerbating any kind of reactivity or anxiety. We've got a question in the chat from Sharon. So much controversy about what age to neuter a male puppy. What are your thoughts? So neutering of male dogs is really for human convenience most of the time, unless you've got testicular cancer or something like that, or prostate issues in an older dog that you need to neuter them for a medical reason. Now, this is because entire dogs with testosterone on board are, shall we say, a little bit more challenging than dogs that are neutered. Testosterone increases energy levels, that increases sexual drive. Sometimes when you desex dogs, they become a little calmer and a little bit more chill. Now, I think it's ideal for a dog to at least get to physical maturity before desexing. The sex hormones, testosterone and so on, have really important functions in the body in terms of vitality, longevity, and generally the research generally seems to show that you do have decreased vitality and decreased longevity if you desex your animals. So 6 months would be the bare minimum age. Now, Mitzi here, this little guy, I was going to keep him entire, but when he hit 6 months of age, he had so much testosterone. He had about 10 Great Danes worth of testosterone in his little fluffy body, and we couldn't live with him. He was coming to the house and lift his leg on everything, no matter how we tried to teach him not to do it. and he would go completely insane for 2 weeks if there was a bitch in season within 10 miles. So we desexed him at 6 months of age, and he's been totally fine. But my preference would still have been to keep him entire if he was the kind of dog that I could live with as an entire dog. If you do keep them entire, you do have the risk of testicular cancer. That's very low. And you do have the risk of prostate cancer. But physical maturity is usually around 2 to 3 years of age in your average dog, maybe a little bit earlier in big dogs. We've got a question from Julie. Our little grey kitty had blood diarrhea, is on a special diet, prednisolone and vitamin B. He seems a little deformed, skeletal, hard of hearing, howls and cries out very loud walking around the house. Okay, so I think here it's a bit hard for me to say too much about a cat like this. If you've got a cat that has got deformations and kind of problems that have come with birth, all you can do is to do everything you can to support what vitality that animal has. A little bit of slippery elm in the food can help with gut issues. It's a nice, natural, safe herb that soothes the gut. But in terms of advice for a case like that, I'd need to have a consultation to be able to really give you meaningful advice. I can't give you detailed advice in this kind of situation. From Malgotha. What does it mean if my Dachshund didn't look at me in the eyes and didn't greet family members when they came back home? He used to stay on his own the whole day and didn't initiate the contact. So I've found sometimes if you've got animals that have had silent pain, soft tissue pain build up in their system over months and years, that if they have high levels of undiagnosed hidden pain in their body, then they can become kind of withdrawn and not engaged and kind of a bit depressed. So this is something that you really should look into. Again, our whole energy body balance programs help you with that. And we do have regular free silent pain intensive online workshops that you can come along to and learn all about the problem of silent pain, why it is so easy to miss, and what sort of problems it can cause. Another question from that same person: why should we not massage animals with cancer? Is this absolute? I think that if you're not doing deep work, then gentle massage can be helpful in cancer, but you probably would want to talk to your vet before you consider doing anything like that. Certainly, some types of cancer, more like lymphatic cancer, probably not such a good idea to massage, but you can still use very gentle, non-invasive types of touch like craniosacral and more energy-based therapies that can really help animals with cancer. And one more question from that person: do you believe in communication with deceased animals? And can you recommend any such communication? Certainly, when you come to the intuitive energy work side of things, I believe that you can have some kind of communication in those contexts. And sometimes it can be really helpful with healing and grieving and moving through the loss. From Rox, another question submitted online before we got here. Are grapes actually dangerous for dogs, or is it yet another myth like avocado? Grapes are actually dangerous for dogs. It's not a myth. Now, it's kind of inconsistent because sometimes dog might eat, an amount of grapes and not get sick. Then you might get another dog eats one grape and it can send them into really severe kidney failure and even kill them. So there is a toxic compound in variable levels in grapes, and you should never give your dogs grapes or sultanas. It's very unpredictable. Some dogs with some kinds of grapes will be totally fine. Another dog will have just one grape and get hideously unwell. So you do need to be aware that grapes are a definite no-no for dogs. And are vaccines actually necessary for dogs? Goodness me, that's a question that I could spend about half a day talking about. Vaccinations are proven to give really good protection from disease, and at the same time, they're not risk-free. Now, if you live in an area where there's a lot of parvovirus, I think that it is wise to vaccinate your dogs. But at the same time, you don't necessarily need to vaccinate your dogs every year or every 3 years, because the modified live virus vaccines for the C3, distemper, canine hepatitis, and parvovirus that we use these days give a very long-lasting immunity of 5 to 7 years. And you can do a titer test, which is a little test where they get a little bit of blood, look at the antibody levels in the blood, and can tell you whether or not your animal needs to be revaccinated. Every animal that's got a healthy immune system and has responded to a vaccination should have at least 5 years protection from a core vaccine, the C3 vaccine. And you can then titer test once you get out to maybe 3 years, if you want to be super safe, to see when the antibodies levels get lower, and then you only revaccinate. Well, my advice is that you only revaccinate when the antibody levels do get lower. Denise has got a question on the chat here. Is there a herb that I can use to help with eye support? My old lad at 15 years had a couple of eye ulcers. I'm not really a fantastic herbalist, and I don't have an answer for you on that one, sorry. Megan Hughes says, I'd be very grateful if you're able to kindly cover cat dental health from a functional medicine perspective, i.e. some effective measures that can prevent or at least minimize tartar, reactive gingivitis, decay, etc. Essentially vet dental interventions through a cat's life. The most effective way to keep any carnivore's teeth clean is size appropriate, meaty bones. They need to be, in the case of dogs, not weight-bearing bones, not like the big femurs and soup bones and things like that, because they're much harder and have an increased risk of cracking or damaging teeth on them. But that's the most effective way to keep your carnivore pets clean, is age and size appropriate meaty bones 2 or 3 times a week. Or maybe twice, once or twice a week even will make a massive difference. Apart from that, avoiding processed food, feeding a fresh whole foods diet, a BARF, B-A-R-F type diet. Also, when you get the carbohydrates out of the diet, you get a lot less, in my experience, you seem to get a lot less tartar build up. Your pets, when you have you should always have an annual veterinary check. And your vet then, if you find tartar, the only way to really effectively treat that for your animal is to have an anesthetic and have the tartar cleaned off, scaled and polished, just like you went go to the dentist yourself to have tartar scaled and polished off your teeth. Now, the other thing about having regular dental checks in terms of a general anesthetic and x-rays of the teeth and mouth is that then you can see what's going on under the gum line, and you might pick up tooth root abscesses and things like that that are not visible on a physical examination, but could be causing a lot of pain, suffering, and be a real drag on your animal's vitality. So healthy meaty bones, fresh whole foods diet without grains and carbohydrates, no processed foods, and then regular veterinary attention and dental care under anaesthetic as needed would be my answer to that. Isabella on the chat says, my sweet little girl is now 9 years old and unfortunately had a bad back. She's under care of a chiropractor every 3 months to set her vertebrae back where they should be. She also gets some supplements like Devil's Claw to lower down the pain. I did give her CBD also, but stopped after a while because I didn't know if she would get tolerant of the CBD after a while. So you can give CBD long-term. It's a very powerful herbal anti-inflammatory pain relief for your pets. I have a lot of animals that are on it long-term if they've got chronic pain issues, and it works a treat. If you want to learn how to help your animal with their back pain, then come along, drop into wholeenergybodybalance.com, come along to our free silent pain online workshops, pet silent pain online workshops that we offer every couple of weeks. And you can do a lot with therapeutic touch, and we teach people all over the world how to do that. So it would be something that is likely to make a big difference for your animal if you come along and do that. And you, absolutely, Isabella, I think you could very much make a difference for your old girl with the body work that I teach. I've seen a lot of older animals that once we do body work with them, they get a lot happier, a lot more active, a lot more mobile. And sometimes they start doing zoomies or digging holes and things they haven't done for months or years. From Lawrence and from Denise, which tick prevention product would you recommend? My old girl has Marcel and doing well, but has picked up ticks in the last 2 years, and that's using a natural spray on walks. The tick issue and the flea issue, because it's the same kind of chemicals that are used in preventatives for these, is just all rocks and hard places. It's a very challenging thing, because particularly in Australia, where we have the ixodes, the paralysis ticks, but also in the USA and Europe, where you have ticks that carry Lyme and rickettsia and other mycoplasma and a whole lot of other diseases that can also cause a whole lot of harm to your pet. And here in Australia, we've got a new tick-borne disease too, which is moving through the country, which can also absolutely make dogs very sick and kill them. So this kind of prevention of these parasites is very important. But there is significant risk attached, in my opinion, to a lot of the commercial products, particularly the ones that have the insecticide class of isoxazolines in them. So that's NexGard and Bravecto and a few others whose name escapes me right now. There's a lot of anecdotal evidence of people's animals being injured, causing fitting, causing a whole lot of other troubles, and there's a significant number of animals that have been killed by these products. But the problem is they're highly, highly effective at preventing the ticks. And here in Australia with paralysis ticks, those ticks can cause death too. So this is the rock and the hard place. Sprays, they're going to maybe prevent your ticks. If you're not going to use a heavy-duty chemical preventative, in fact, even if you are going to use a heavy-duty preventative, what I recommend to everyone that lives in a tick risk area is that you feel right over your dog's complete body with your fingertips every day. Now, you'll feel even through a really heavy-coated, long-coated dog, if you're running your fingers over every bit of the body, you'll feel the lump of the tick very, very quickly and easily. Then you'll be able to remove them. Make sure you get a tick-free spray and you freeze that tick to death before you pull it off. Then they don't regurgitate their gut contents into your dog's bloodstream, which significantly increases the risk of infection with these bacterial infections as well. When I was living in a tick area, I used the Kill Ticks collars, which are an older school kind of chemical organophosphate. Now, if you do get a toxicity with that, you can give the dog atropine in the vet clinic and reverse it immediately. However, those kind of collars don't work well if you've got a dog that likes to swim and get wet. In fact, they don't work at all. Both my dogs hated water, so that was okay. So no easy answers here. Risk-benefit, you have to look at the risk-benefit. Many dogs will be able to cope with the isoxazolines and be okay, but there is a toxic load and there is a risk that you can do serious harm. We've got a question from Rita, and those of you who are here live, this is your last chance to ask a question. If you've got one, ask in the chat and I'll answer it. I'm going to answer one more question, the last one from the pre-questions that our community gave to us. Excuse me. And then if there's one more question here in the live, I'll answer that too, and then we'll wrap it up for today. So from Rita, I have 2 chihuahuas with patella problems. One also hurt his cruciate tendon. He's in a lot of pain sometimes. What can I do to relieve his pain? He seems to like heat. Okay, so if you've got a ruptured cruciate ligament, then you really need to go and see your vet. If you've got the whole luxating patella issue, I would strongly recommend that you get that assessed by an expert orthopedic surgeon, veterinary orthopedic surgeon, a specialist. Sometimes if it's mild patella luxation, then it's going to be okay to keep going without surgery. But sometimes doing surgery really significantly reduces pain and increases quality of life for these dogs. Ruptured cruciate, rest, natural anti-inflammatories like CBD, perhaps stronger pain relief from your vet. But with a case like this for pain relief, I'd strongly recommend you go and talk to your vet. And, you know, I'm available for online and in-person sessions as well if you want to have a more kind of holistic, integrative perspective on what kinds of things you can do. But I can't give you specific advice on an open call like this without a consultation. Okay, I think we're done. That was a lot of fun. Thank you so much for all your questions. Hope this has been helpful. Have a beautiful day with your pets, and I will see you, if I can find my little mouse thing here, Next time we do one of these, I'm probably going to do one of these about once every month or two. Just have a ask me whatever you like, because I find it's heaps of fun to do that. Have a beautiful day with your pets. We'll see you next time.